We need to clear the air on the rumors associated with the mass drug administration for filariasis. Only MDA is to eradicate the filarial worm or the disease of filariasis from our country, which at the moment the levels are at the eradication phase. Now compared to Toleafoa, Tonga, Marshall Island, even Solomon Islands, they have eradicated filariasis. So that was the main aim. This is one of the recommendations. We've been liaising with WHO on our strategies to have the rounds of MDA. This is not new. We did it before. And I think we had 2 rounds before the tsunami. So the 3rd round was disrupted in 2009 because of the tsunami. So we had to postpone it to 2011. And after that, we did a trans-assessment survey, noting that there was quite a particular area of Samoa that still has the microfilarial parasite. So we did another round focusing on that area we identify as Northwest Upor. So it was okay. But last year, we had another trans-assessment survey. We've noted that there are red spots all over the country, including Hawaii. We've noted a slight resurge in the number of cases positive for the microfilarial worm. Hence the planned MDA this year. So this is a wide out. And we've set criteria for those taking the medications and those that we will not give the medications, such as pregnant women, children less than 2 years of age, those who are severely ill, lactating mothers, the elderly, any epileptic children with recent episodes, people with heart problems experiencing some symptoms, and then those who are obviously allergic to the medication. You may notice that this is the first time we've approached taking the medications to the schools and then follow up with going to the families door to door. Now the recent events, it's sad to note that it's been linked to the MDA, but the recent deaths, supposed from a female at Momoa, I've seen the death certificate. She passed away because of some overwhelming septicemia from most likely a bad chest infection. I have a death certificate here. And she took the medications 3 days before she passed away. So it may be a coincidence. But I think I don't want to add more salt into the wound. The family has requested their privacy on this, especially the children who are so attached to their caregiver. So that's the kind of information I'm giving you today. There are other deaths, like there was a man from on that side of the island, but he is a known case. He's very obese, and the family knew that he slept, and it's a high-risk case. And there is no record of him taking the medications. So it happened at a time or the context of the MDA. Now these are some of the things. We've also been, someone called also an advisor that there was a child that was given twice the medication and collapsed, blacked out. So I spoke with a team leader they have no record of that. They have no record of any incident. So I'm just clearing the air and hoping that the media will assist in making sure that these rumors are corrected